Welcome back. Now, a report by the Human Sciences Research Council has found that Gauteng has recorded a high prevalence of HIV among residents aged between 50 and 54. The survey further suggests that an estimated 1.72 million people were living with HIV in the province in 2022, representing a decline of 0.2% from the 1.780 in that year reported in 2017. Now, public health advocate Dr Lethukwenama Letsoalo joins us for more on this. Dr. Letsoalo, thank you so much for your time this evening. I guess if we can just get a bit of an explanation as to why this age group, the prevalence between 50 and 54, and also in previous years, wasn't it always younger age groups?
Thank you so much. Good afternoon, good evening rather, to you and all your listeners at home. So I think what these numbers tell us, as we see more people in the older population living with HIV, it's because people are living longer with the disease, because that means that antiretroviral therapy is working, so the ARVs that people are taking. So this means that, we're actually making great progress and we're not losing as many lives as we did before to the HIV pandemic. And then secondly, I think it also indicates that we might be seeing new infections within this age group, which can also be a cause of concern as well.
Yeah. Also, when we're talking about this group in Gauteng as well, looking at the group 25 to 49, now the study found that they account for the highest number of people who don't know, who aren't aware of their HIV status as well. Where are we when it comes to testing right now? Are people doing it as frequently?
So that's a good question, right? And I think our healthcare system, whether that's public or private, has moved and done great strides into making sure that there's access to testing services. So you'll see that in a lot of different communities, there's even different NGOs that are offering access. And it's also free in public health facilities, so that can be your hospitals or your clinics. So I think the services are there and are available for people to access, but there are just other barriers such as stigma around HIV. People are still scared. We hear a lot from patients saying that I'd rather not know my status than actually go test, and actually have to deal with the consequences should that be positive. So there is still a bit of hesitancy, but we've done a lot better in terms of having access to these kind of services now.
And looking at these numbers as well, Dr. Letsoalo, you're mentioning that the 50 to 54, it's almost good news because people are living longer. But looking at numbers from previous years as well, the prevalence age, like we mentioned before, was, round about the 35 to 39 age group as well. Are we seeing, though, now that group 35 to 39 and younger, are there less cases of people living with HIV?
Please repeat the last part of your question. I didn't catch that.
Just talking about that group, in 2017, the group 35 to 39, they were the prevalent age group that was living with HIV. And to your point, people are obviously aging and living longer, which is good news. But as we then grow and get a new crop of 35 to 39-year-olds, are we finding that age group now in 2024, it's decreasing when we're looking at people living with HIV?
So yes, the numbers that we have at the moment show that everyone under the age of 49, we've seen a reduction in the number of people living with HIV in that age group. So that is some progress. But I think one of the issues that we still face is that the HIV pandemic still disproportionately affects young people and young women in particular. So if we look at the numbers released by the South African Medical Research Council, they show that for teenagers or young people aged between 15 and 24, the women or the young girls are twice as likely to have HIV, and that's what the numbers are telling us. So, which is why the work that we are now doing with the Forever Winner campaign is so, so important. Because we're saying to young people, come to the table, let's talk about HIV, let's talk about your safe sex practices. How are you protecting yourself? How are you protecting your partner as well? And there are different ways that we can do this. And what they were releasing as well now with the Gauteng data is that a lot of people do not know about PrEP, right? So PrEP is pre-exposure prophylaxis, So this is for HIV negative people to actually take medication so that they don't get the virus. So only 33% in Gauteng knew about this, but we see that more than 60% would be willing to take it should they find out more information and know about its availability. So I think that there's a lot of work that needs to be done there. And that's why we're having this conversation with you right now. And that's why we're saying to young people, let's have these conversations, even parents at home. What sex talk are you having with your child? Are they going to be learning it out in the streets, or are they going to learn it in the comfort of their home where an adult can give them accurate and proper information?
Yeah, and to your point, Dr. Letsoalo, talking about parents also speaking to their children too, the study also found that girls aged between, or girls and boys aged between 15 and up, only 70% of them said they actually use condoms, and some of them said they actually don't use them at all. 70% of them said they don't use them at all, which comes to your point of these conversations that need to be had. Are you finding with campaigns like Forever When, that you are also obviously spearheading as well, that it does make that shift too, that the topic of sex in the home between parents and young children or teenagers, young adults as well, becomes less of a taboo?
So I think we are making a bit of progress, but there's still so much work that needs to be done. You know, you look at different communities, especially in your rural communities and, you know, your very traditional and cultural households, this topic is still very taboo, it's still very uncomfortable. And then you get into the cities or university spaces where you see a lot of young people, and that's where people are, you know, more able to engage in these kind of uncomfortable conversations and demystify them. So I do think that we need more awareness around these campaigns, but also just on your point about PrEP and what other services are available with condom use, that has actually shown a decline. For young women in particular, we also need to be looking at contraceptives, right? You may have seen data that was released a few weeks ago of the high numbers of teenage pregnancies in the country. So this means that, you know, we need to look at the uptake and the education that we give to young girls about contraceptive, safe sex practices and how to actually protect themselves, because a lot of these factors also just cause a ripple effect on the poverty cycle, right? And just on condoms again, it's the condoms don't only protect you from HIV, but also other STIs. So that's why we're really stressing for young people to be able to access these condoms and find ways to use it and work for them as well.
On the point of contraceptives as well, interestingly enough, I think it was a week or two ago on this program, this very program on News at Prime, we're talking about a study that found that when it comes to contraceptives, particularly in rural communities as well, there's always seemingly a shortage of stock as well, which obviously doesn't also help in this plight too.
And I mean, that's unfortunate. I think, you know, we have a decent healthcare system that has its own challenges and its own shortfalls. So in some communities, especially like, you know, those that are far out, there are cases of stock and resource shortages, which, you know, in some places you'll find that there are NGOs who are able to fill that gap. We have these pop-up tents that you might see on the roads and on the streets. So if people do see those in their communities, they really shouldn't hesitate to go out there. And, you know, especially for people who are still in school as well, there's also mobile clinics that come to schools and offer these services to young people with consent, of course.
And just before I let you go, Dr. Letsoalo, if you had to look into your health future goal as well and just kind of predict to, I know it's a bit of a hard question here, but in terms of the stigma, you know, we still speak of the stigma. You mentioned the stigma as well. Do you think we'll be able to eradicate this, at least in this lifetime?
I'm hopeful. I'm a hopeful optimist. I think we just need to talk more about it and make it less comfortable. And it needs to start very early. It needs to start in preschool and primary school, where we teach people and young girls and boys about their bodies, how to respect their bodies, where we call body parts their names and not call them dollies and other pet names. And that's where we start getting real about what the real things are and what it means when you start having sex. Because another thing that contributes to all these statistics that you and I are talking about now is the early sexual debut. So if people are having sex early, then, you know, they are prone to all these risky behaviors and the consequences thereof. So I think we need to carry on the conversation. So you can actually reach us on the Forever When page We are on Instagram, we're on TikTok, as well as X. And then we also have a WhatsApp chatbot. So if you have any questions regarding your sexual health or HIV, you can definitely send us a WhatsApp, and then we'll be able to communicate with you.
Well, that's exactly where our viewers then need to go to access more of that content from you from Forever Away. Now, thank you so much, Dr. Letsoalo, for joining us to talk about this very important conversation.